Hello, I'm Susan Baumgaertel, and welcome to Navigating Your Health with myMDadvocate, Episode 2, What is My Diagnosis? So I hope you enjoyed Episode 1, which was I Can't Find a PCP. So we're going to launch into kind of the complexities of finding a diagnosis or kind of rallying your team to help you understand your medical concerns. And I'm just going to kind of start off with, do these following scenarios sound familiar? So you have been referred to yet another specialist, but your medical team is not coming together on what your diagnosis is. Think about that one. Or, despite the sharing of electronic medical records, it seems that medical offices are so busy and so short-staffed, your portal questions go unanswered, and your long list of symptoms is not getting any shorter. That applies to many of you, I'm sure. Or you feel your tests, aren't enough, that maybe you need more tests, more studies. You're just not sure. And Dr. Google is not helping. Oh, God forbid, Dr. Google. Or you'd like advice on how to engage your medical team for better support. So, sadly, these scenarios are more common than one may think. Getting a diagnosis is not always an easy undertaking. So what is a patient to do, and how best to navigate this maze? Well, you guessed it. We're going to start with some patient scenarios, and I'm going to profile a few stories. Once again, the names are changed and information is genericized, so I protect patient privacy. So patient number 1 is Brian. Brian is in his early 50s. And he was experiencing many different symptoms, many different body parts, organ systems, already had consultations with several different specialties, but was not making headway. And, he became aware during this journey of new family history. And so he really was concerned about a potential genetic risk for illness. And this just added to his anxiety and his angst. And, care coordination became a challenge across different disciplines and different organizations. Not, again, for lack of interest or capability of his actually excellent medical care team, but just kind of the cross purposes and trying to reach out to different people got so frustrating. And he and I sat down frequently and reviewed his lab results and test results because those were really of paramount importance to help him decipher what was going on. So I think that was clearly something that was a challenge in his certain circumstance. Patient number 2 is Mary. She's in her early 50s. And she had already seen several specialists, had very thorough evaluations. These were in 3 different disciplines, so very different specialties. And she was really trying to put things together to better understand her treatment options. She was very proactive. She wanted to understand the data and really, it wasn't quite clear cut what she should do. Different physicians had given her a different picture of what she should consider. So I actually dove into her electronic health records, found an MRI from years ago, actually from the East Coast, and that contributed to the discussion and helped her prepare for subsequent visits, which was of great value. And, let me just make a point that I'm actually on active staff. I have privileges at Providence Swedish here in the Seattle Regional Medical area. And so I have access to Epic, which is the main electronic health record system that most organizations use, or many use now. So the kind of silver lining was that I could really mine data and look with great depth into her records, even from years ago and from different organizations. So that was of great help. Patient number 3, Stephanie. Stephanie's in her mid-60s. And when I met her, she was, hearkening back to 20 years ago when she had an autoimmune diagnosis, and then she had her specialist retire, and then she didn't have an autoimmune diagnosis. And, this was kind of all over the map for her. Every time she met a new person, a medical professional or physician, and they came up with a different idea of what her problems were. And so it was very confusing. And 20 years of this. So fast forward to now, she still has conflicting advice from different professionals. And that's just really been demoralizing in so many ways, as you can imagine. This has been a very lengthy journey. And, records are all over the place and hard to piece together. And so that's something that is of pretty significant, has a significant impact for her as we kind of plow through what her current health conditions might be. So getting a diagnosis. The fourth person is Diane. Diane's in her mid-70s, and she has, confusing symptoms. There was a period of time when she was sick. Was it COVID? Was it a head cold? Was it sinusitis? Was it bronchitis? So many different possibilities. And unfortunately, she really had quite a challenge accessing primary care, and was a bit reluctant just to go to the ER. Who wants to go to the ER in our world of COVID these days? They're so busy. Obviously, you don't want to go there if it's an emergency. But, I at one point, I suggested that she needed urgent evaluation because it was clear to me that something was falling through the cracks. And lo and behold, she went to the emergency room, was diagnosed with pulmonary emboli, which are blood clots in the lungs, both sides, and she was admitted to the hospital. So, holy cow, that was a good scenario for her. She's doing great, but kind of a scary time period, and that's kind of food for thought. The last patient's Annie, and she's in her mid-50s. She had a bona fide COVID exposure, big gathering, lots of alerts afterwards, COVID. She had symptoms. She was 100% sure she had COVID, but all of her tests were negative. We're talking PCR and home testing, and then she had excellent evaluation with her primary care physician. They listened to her, examined her, they did labs, repeated tests. And then the portal message, through MyChart, through electronic record, came to her that, hey, everything looks great. And, she just, something just wasn't right. She trusted her inner instinct that, maybe she had COVID. She couldn't really prove it. So we had to kind of sift through all these possibilities, and I was actually able to reinforce her primary care doctor's advice and give her added reassurance, which I think was of great support. So let's step back for a minute and talk about the electronic health record, or EHR. It was life-saving in many ways. The original purpose way back when, it was for information sharing, get documents all in one place, allow the right hand to talk to the left hand, specialty, interspecialty sharing, medication management. There's a long list of positives for the EHR. But, sadly, the original use is not the current use. And I'm not alone in the medical profession when I kind of lament the fact that it is, what was a communication and information sharing tool, to a certain degree it still is, has really turned more into a box checking device. And sadly, it's kind of rigged for billing and coding. And boy, I could riff on that for a bit. But really, I bring this up because of the inaccuracies. And, I'm a patient too. I get medical care. And I really feel that the errors replicate like bunnies. So, if you've looked at your problem list, I'm sure you've wondered like, hey, wait a minute, elbow fracture, that was like 14 years ago. Why is that still on my problem list? Or things that just don't seem right, or one doctor thought it was this diagnosis, the other one thought it was this, and so they're both on there. It gets very confusing. Don't even get me started on the medication list. What you may not know, that what the consumer, the patients may not know, is that all these organizations can kind of true up and cross-pollinate and talk to each other. And so the medication lists are often pulled from all these different organizations. And so you have this, often mammoth list that, in my opinion, is almost never accurate, woefully inaccurate, and forever and a day. As a physician, I've been trying to tidy those up, and as a patient, point that out. If there's a medication I stopped 3 years ago and it's still on there, that kind of bothers me. Allergy list, some people's allergy lists are this long, and I would really offer that many of these allergies are more intolerances. So if something caused, minor itching, or something caused, very, brief loose stools, that's not really an allergy necessarily. I would say allergy is a global rash, or, closing throat, you can't breathe, and shock, and so on. But that does influence physicians when they prescribe things. So that really is important to keep track of. The other thing too, which is really not as easily seen from the patient perspective, is that many physicians will template their notes or carry over from their notes. And what that means is they use a kind of a grid, a guideline, a template that really just it has all the elements of their note in it, and they just kind of fill it in. Now, on the one hand, that's fantastic because it gives them more time. Lord knows they just don't have time. They are in pressure cooker situations to get things done right. But on the flip side, the moment you have a templated note and there's something that's not accurate or is out of date, it often gets put forward. And that's where some of the inaccuracies lie. And so you get a specialist who hasn't seen you, and they look at your chart first and they see a note, and that note is, in your opinion, from the patient's perspective, not exactly reflective of what your condition was, or perhaps what you had said, and yet that becomes the truth. And I think that that's where I feel like the patient voice has been literally smothered. And so, back to clinical medicine, a diagnosis doesn't just fall out of a tree. Well, sometimes maybe it does. You fall out of a tree, you fracture, that's your diagnosis. But, there are many moving parts. So there's an initial evaluation. There's usually an examination by a physician. There's labs. There's often diagnostic testing. Many times that you might need a specialty consultation, or more than one. And then sometimes treatments are started, and it's a matter of seeing how you respond to treatments. And then, of course, there's tincture of time. And so many patients get understandably frustrated when their care seems more like trial and error, or they get conflicting opinions and advice from multiple different physicians and other specialties. Well, that's where I have a phrase, the art and science of medicine. That's part of the art of medicine. There is no cookbook, you just don't Google something and treat somebody. That's pretty bad medicine. There's a depth and breadth of experience that's brought to the table, and a physician that's listening to you, is caring for you. There's the art of medicine that is kind of overlying the science, the evidence-based medicine, and the years and sometimes decades of training experience. So it's all kind of wound up in that, and that's inherent in a diagnosis. So, about Dr. Google, just get rid of Dr. Google. Dr. Google is not acting in your best interests and is not a doctor. So just remember that in my practice, myMDadvocate, I can serve as an ally to your primary care physician, to your medical team, in a very collaborative and not competitive manner. So, thanks for listening. I hope you enjoyed spending a little time learning about the challenges of clarifying a diagnosis. And I hope you'll join me next time for episode 3. I'm going to mix it up a little bit this is going to be called I Need Caregiver Support. So have a great day, and thanks for listening.